Now, when we are talking about reversal order of appearance of system, so a simple example, what Hahnemann sir has also said in that footnote 168 when we had talked about it, कि when you give a right medicine, what happens is after giving this right medicine, the cure has to comes up, and all those symptoms which were there previously have to follow that chain. So if I am traveling, so I have to come back with the same route. I have the last station becomes my first station. So when I'm treating any case, the last symptom becomes my first symptom to go back. So reversal order of appearance of symptoms is another corollary. So last symptom appearing should be the first to disappear. So theory of suppression, cure in APUD system. So when you are curing, so what will happen is, see, once I had discussion with sir, I asked him, Ki, sir, is it possible to jump from one layer to another? Sir said, no, it is not possible. You might miss your observations, but the cure process has to be the step down process itself. If the genetic code is affected, the neural plate is affected, that is the sixth and seventh layer, there you might have a compensatory cure. Yes, he said. But when we were talking about the development, as I told you, the skin develop. The skin is the least important organ, but the most important organ is the genetic code, the mind of the cell, the central nervous system. So we have to follow that reversal process in that certain set of symptoms only. If anything is missed, if anything goes against the principle, the medicine is wrong. I have many examples where I missed, Arey, how is it possible? And I got into a failure because something got suppressed, because I missed that point during the cure process, because somewhere I jumped into it and I was very happy. In a case was of paralysis, I think, and in that case I was very happy because patient landed up with BP. But then I understood ki no, this was wrong, because the patient has landed up into something syphilitic, something in a gross miasm. The BP was not under control, the hypertension was to the range of 200 220. So this is wrong. In case of kidney patient also, if the patient starts misbehaving to you, the symptoms go haywire, that means your remedy is wrong. The patient has landed up into ketoacidosis, the remedy is wrong. So therefore the reversal has to be in a proper stepwise way, in a certain defined principle. It is not jumping up the steps. It has to be from one tissue to another, to one organ to the second. So growth axis also follows the nutrient gradients. As you know that toxins are being transported with an active. So energy is not needed when you are pulling you feel so relaxed after passing your normal stools in the morning, or you evacuate the toxins of your body through urine. You feel so relaxed. You don't need an active energy. But if you are diseased, if you have constipation, you can feel you need so much of energy to evacuate, and still you feel that your energies are too downgraded. You don't feel relaxed. So this is how your energy gradients and the gradient of nutrition has to work. So everything has to be following that corollary. The gradients flow from above downward, the growth axis is above downward, more important to less important, center to periphery, from inside to outside. So this has to be there, and this growth axis is nothing but being defined by Woolpert and Waddington as the nutritive gradient. And from this, I think Herring sir, we can understand how Herring sir has defined. So growth axis is equivalent to the Herring's law, the corollaries of Herring's law. So where this Herring's law have come up, you can explain it through the growth axis. So when the growth gradients, the toxins gradient of your body are following these set of rules, then how is it possible that Herring's law or the cure process will not follow this? So we are following all these principles in homeopathy, in predictive homeopathy, by clearly defined principle laid down by Hahnemann sir and very much explained by our Bade sir. So as we all know, these toxins are being pushed up, and when this electrical potential is disturbed, and the disease process there, the electrical potential goes against, and the disease has been pushed up from outside to inside. So reversal of miasm is the sixth corollary. Till now I made myself very clear. Now, reversal of miasm is something going ahead of every other thing. I'll tell you, reversal of miasm becomes very, very, very important, because reversal of miasm will defy every other rule. If I say syphilis has to go, psychosis has to come, sora has to come up. It is not possible that you say that syphilis is not getting cured and psychosis is developed. No, syphilis has to come down, psychosis has to develop, and sora has to come up. Now, get an example like a case of some necrotic dead tissue which was happening, a gangrene or something. So this is a syphilitic destructive disorder. If it goes, then a proper this gangrene or necrosed tissue has to heal, a proper granulation tissue has to come up, and after a proper healing, a proper granulation tissue, the proper wound healing has to come up. So syphilis, psychosis, and sora, this is where the reversal miasm has to come up. If a patient of diabetes is coming to you with diabetic nephropathy, diabetic neuropathy showing lot of destruction, but while treating, the syphilis goes down, the nephropathy, neuropathy goes down, there is slight change in the parameters of lipids or the cholesterol, then this is considered as psychosis, but this is healthy psychosis. And then later on you see the changes like allergic rhinitis comes up or something like git comes up, so sora comes up. So anything in reversal of miasm is taken as the key principle to understand the process of cure. So this is destructive miasm going to a constructive miasm, and from constructive miasm to a primary defense, which is very, very important. So reversal miasm is like a bleeding ulcer scaling into hyperkeratinization, then on itching coming up, then a bleeding wound with necrosis goes to hypertrophy of scar, and then a beautiful healing. So revised Herring's law according to us will be, first corollary is reversal of miasm becomes very, very important. Then the more important to less important, above downward, sorry, center to periphery, above downward, within outwards, and reversal of appearance of symptoms, that is again a reversal of miasm, as you say a clock. So this becomes very important, explaining to you how Herring's law is correlated to embryology, why we need to understand embryology. So compensatory cures are the cures which takes place in the seventh layer. So cure is restoration of near normal functions with sensation of well-being. This is a limitation I will say, because the cure here is restoration of near normal functions with sensation of well-being and prolonging the existence in spite of the pathology. So somewhere people might argue with you ki what seventh layer talks about and what you're talking right now. So I'm talking about the compensatory cure, because in the seventh layer where the mind of the cell is being disturbed, it is impossible to complete the reversal process. Yes, but it is possible to work on the existence, that is the first instinct of the cell is survival. So we are working upon the prolonged existence in spite of the pathology. If we are able to survive the cancer patient with a better health, then I will say, even if the necrosis is not reducing but the general health status is improving, the life is there, he has landed up into diabetic as a compensatory cure. Yes, we have prolonged the life of the patient in spite of the pathology. You will say to a cancer patient, if you give diabetes, I'm happy, because diabetes will not take the life of the patient but definitely will give a compensatory cure. So in Herring's law, in chronic cases, in acute cases, will definitely vary. In chronic cases, as you all know, ki since the disease pathology has lot of advancement, the disease is not in the layer of itis, but it has developed psychosis and syphilis. It is not in the stage of sora in chronic cases. So reversal and the phases will be different. Whereas in acute cases, Herring's law will be different. Herring's law, the timings will be different. And since it is in the phase, in acute cases, it is in the phase of SORA, it is in the phase of inflammation. At the primary level of inflammation, the symptoms will vary. So, in acute cases, if you see Herring's law, there will be difference from the chronic cases, because here both the miasms are different. So in chronic cases, since it is psychosis, constructive miasm is there, or the syphilis or destructive miasm is there, so you have to reverse it accordingly. And in acute cases, it is either SORA or syphilis, so you have to bring it down in that way. So in aphorism number 161, what Hahnemann says is that in original diseases, to the first or few hours, so when he's talking about homeopathic aggravation or primary action of homeopathic medicine, that seems to increase somewhat the symptoms of the original disease to the first few hours. This is certainly true with respect of disease of a more acute character and of recent origin. But where, see the difference between acute and chronic, what we were talking about. So he has mentioned, when you're talking about acute, so first few hours you will find the changes, but where a long acting combat a malady of long standing, where no such apparent increase of original disease ought to appear during treatment, and it does not appear if the accurately chosen medicine was given in a proper small gradual doses, higher doses, each somewhat modified with renewed dynamization. Such increase of the original symptom of a chronic disease can appear only at the end of the treatment, when cure is almost or quite finished. So this is what Hahnemann sir says, ki there will be a difference, ki when you are treating an acute, the cure process you can see within minutes, within seconds, but when you are seeing chronic, it will take a certain time to see that compensatory mechanism coming up, or sorry, the cure process coming up. So Hahnemann sir has already defined, but what we do in predictive homeopathy, we try to see ki how the disease is coming up. So when you're talking about ectoderm, when you're talking about the ectodermal tissues, when you're talking about the ectoderm, so itis, all the inflammations at this ectoderm, conjunctivitis, you talk about blepharitis, you talk about otitis, you talk about rhinitis, you talk about stomatitis, you talk about dermatitis. So all this is ectoderm, and you all know this is primary inflammation at this stage. That is, the cure will be from above downwards. So anything which has happened to the eyes, it has to come from the skin, it has to come on the skin. So inflammation has to come down. So we all know the disease progress is from below upwards. So anything which is pushed from skin to ear to tonsil to eye to the lips or the palate. So if you see, after giving your remedy, if the patient complains, if a patient of eczema has come to you and he comes up with otitis media, remedy is wrong. If he comes up with tonsillitis, remedy is wrong. So this whole disease process is from upward, and the cure process will be definitely above downwards and leftwards. Leftwards matlab from syphilis to psychosis to SORA. I hope I'm very much clear, because don't make confusion, because people come and say, "Arey dermatitis gaya to kya hua?" See, eye inflammation has come up and it's just a viral infection which has come up. No, if skin like atopic dermatitis I'm seeing in children, what they do is they apply some ointments and over the skin they are very happy, but the child eventually comes up with some inflammation of the eyes. So definitely it is a sign of suppression. Then in second layer, again, the cure process here, the diseases like cystitis, you see hepatitis, you see cholecystitis, anything, gastritis, pancreatitis, not pancreatitis, sorry, inflammation of pancreas but not islets of Langerhans, the pancreatic tissue which is involved in the endoderm, because if you talk about pancreas islet cells, they come under neuroectoderm because they are part of diabetes. So lower respiratory, again bronchitis coming up, laryngitis, tracheitis, pharyngitis, palatine tonsils. Again, the reverse order will be disease going from respiratory tract to urinary tract. If you're treating a case, a respiratory patient going to GIT, to liver, to urinary tract, it is a wrong sign. See, patients used to say कि if I have given a medicine for coryza, the patient, the child has come up with diarrhea. And in old days, people used to say if the sardi is getting out through diarrhea, it is a wrong sign. I'm telling you, it is a wrong sign. If the patient has developed diarrhea after giving a medicine for coryza, it is a wrong sign. Don't take it as a right sign. That is a first indication in children where maybe make a mistake. That definitely they will come with some other disease process, or they will bounce back again, because this is not a cure. Yes, if the patient was in respiratory tract and comes up with rhinitis, it is good sign. Then third layer, yes, again I will say all the diseases which are at this level of blood, anemia, if you talk about joint arthritis, synovitis, fasciitis, bursitis, you talk about anything related to bones, muscles, and the dermis, your psoriasis come up, right? So when you're treating this alopecia, I will say you, the alopecia mentioned in this third layer is not alopecia universalis, because alopecia universalis is syphilitic going towards autoimmunity. Not always, but yes, many a times. Even psoriasis and lichen planus are considered as syphilitic, though they are the dermis disorder, but they are syphilitic. So if you have treated a patient of psoriasis and patient lands up into alopecia universalis, it's a wrong remedy. It's a wrong remedy. I'm telling you, you have to be very prompt with the each and every symptoms coming in your follow up, and just see the direction of the cure. If it is from a syphilitic disorder to a psychotic, you are in the right direction. Now, fourth layer, as you know, they are all the organs and tissues which are mesodermal organs. These are the mesodermal tissues what we have talked about, and these were mesothelium. So, mesothelium or the mesenchyme, as we know, this is the mesoderm which was in connection to the ectoderm. And when we are talking about mesenchyme, this was the mesoderm in connection to the endoderm. So endodermal organs or the tissue, they are developing the main substance of the organ and tissues, the main parenchyma, which is the main tissue of the organs. So they are heart, lungs, kidneys, so they become very very important. And again, the cure process is the lymphatics carry all the waste material, so they should not be pushed up inside, they should be thrown away through the venous system, and they are to be excreted out of the body as a waste material. So cardiovascular system, that is the blood vessels, then your heart, then the lungs, and then the kidneys. So if a patient develops, if you are treating a patient of essential hypertension, that is a normal hypertension, and then the patient lands up into secondary hypertension because of some chronic renal problem, your remedy is wrong. If the patient you are treating of hypertension or a simple carditis, myocarditis, and develops into creat values get disturbed, it is a wrong sign, because the patient has gone into haywire state of suppression. Now, if you're treating a fifth layer case, that is the APOID system, all your neuro endocrines, the endocrine system comes up, your thyroid, parathyroid, pituitary, then even your pancreas, which contains the islets, that is insulin and glucagon, everything comes up. Your pineal glands also come up. The pituitary adenoma, the cases of parathyroid hormone, the thyroid glands, everything comes up over here. If you're treating a case of psoriasis and it develops a thyroid, you are in a soup. So you have to understand how the layers have changed. Then the sixth layer is the nerve tissue which is there, or the neurons which are there. Then the seventh layer, that is the genetic code, mind of the cell. So a patient of skin disease, and gradually the patient was of diabetes, and he has developed a haywire attitude, diabetic ketoacidosis, or dementia, or some disorder related to the memory and brain. Yes, this is a wrong direction. You have landed up into a very bad situation. The patient was suppressed badly. So when you're talking about seventh layer diseases, you can give a compensatory cure, taking them to the sixth layer or to the fifth layer. But the disease process are getting pushed up, and I have seen that once the patient see all the common homeopaths who are practicing on multiple doses, for them pushing up the cure process of first and second layer is very easy for them. But we are predictive doctors, we are on the mission, on that fight of curing a patient to healthy state to the cure. So we are the warriors, we are the true front warriors. So we are not running away from these big names of the diseases, but we are the front warriors bringing cure to the seventh and sixth layer diseases. Sir would always roar from the stage and say very proudly, keep predictive homeopathy is where we deal with pathology. We know how to deal and reverse the clock process, because we are going towards the nature's law of cure. And this can only be done when you are defining or standing on these defined principles, and you're very strict to the laws and principles of the cure. So, friends, when you are talking about Herring's law of cure, I will conclude that yes, when if you want, I have also a few conclusions which are not there. Like when you're treating these cure processes, like ectoderm will have a certain process, the mesoderm will have a certain cure process, endoderm will have a certain cure process. You have to be very observant. As you know, the process of ectoderm, the endoderm is through throw something within outward, so you will see the process of cure within outward. Ectoderm, as you know, it is a connection, so diseases of these ectoderm will be related to the connective tissue, connections between the relationship and something, so dirty feeling and all. So that will be a very different chapter where we correlate with the emotional pathology. So if you have any questions, any doubts, I think I was not very fast enough and I could connect to whatever you have asked. Are there any questions? Okay. Uh, any other doubts? You can please ask your queries. I can see few hands being raised. Dr. Sheetal, Dr. Niharika, Dr. Gayatri, and Dr. Sandeep, sir. Please come up with your doubts. When the patient is left handed, if the complaints are on the left side, we need to consider left sided remedy or right side. See, Dr. Archana, when we are treating a left handed patient, the left side of the patient becomes the right side, because the patient is left side dominate, so left side becomes right side and right side becomes the left side. So an example to you, when we see the handedness of the patient, if the person is coming with the right hand complaint and the patient is right handed, so we have to search and find the conflicts of the right side, that is complications with the partner, problems with the work, problem related to the profession. But the left side denotes someone very close to the heart, someone related to you. So when it is a left-handed person, everything is getting reversed. So if a left-handed person comes to you with a left shoulder pain, you have to search out and find the conflicts related to the partner, related to the work, and not to the relationship. Dr. Sheetal, ma'am, you want necrosis. So please be specific what you want as in necrosis, what you expect from me. Okay. Again, if you're talking about necrosis, if you're talking about scabies, scabies is still sora, and if you're talking about necrosis, it is syphilis. So reversal of miasm. Again, I will say you necrosis is syphilitic, where the tissues are getting destroyed. So they should get reversed first, and then scabies is itch, that is primary itching, that is sora. So reversal of miasm will come up over there. Good granulation tissue with lot of red fleshy and good healthy granulation tissue should come up when you're treating a case of gangrene or necrosis. if you have Dr. Sheetal, I'll get back to you. If you have done dressing of patients with these diabetic foot and they all come up, right? So if you have done dressing now, they all we have to remove that dead tissues which are there, and they we are very happy if they come up with red fleshy a good granulation tissue, because it gives a sign of real surviving tissue and a sign of life which is coming in that dead tissue also. But if it is a necros tissue, black dead end, a dead tissue without any life, lifeless, then it is not a good sign. In a diabetic patient, if you're trying to heal that ulcer, right, diabetic ulcer, so if the patient start having it is painless initially, right, but if after giving the medicine starts having that sensation, that is also a very good sign, and the granulation tissue will see that it comes up. Yeah. Fibroids in in breast and uterus. So Dr. Sandeep, I would ask you again to label what is breast, and which layer will be the uterus, and what is the origin of breast, since breast tissues are ectodermal origin, and uterus, which type of fibroid you're talking about. You're talking about endometrial, you're talking about myometrial fibroid, or you're talking about the third type of fibroid. So that will define you which is going to go first. But definitely uterus is more important. I will label it more important than the breast tissue, because again the origin of the tissue is important. Myometrial fibroids will have to go first, then the breast lump fibroadenoma. And if you're talking about cancers, if you're talking about fibroadenoma in breast and fibroids in uterus, again I will say you which layer. If it is endometrial fibroid versus, because endometrial fibroids are second layer, myometrial fibroids are the third layer tissues. Not about the conflict, about the side affinity of the remedy. What is the question, Dr. Archana? Can you be specific? Uh, I didn't get your question. Are you talking about the remedies? When you're talking about the side, you had a question in left-handed remedies. No, the left-sided remedies will be left-sided only. Are you clear with the? Please, can you clarify the question? Yeah, yeah, ma'am. Please go ahead. I can hear you. Yeah. Ha ha ha. Definitely, because it is getting reversed, right? Yeah, yeah, yeah. Sure. Even for Herring's law, even for remedy selection, it is going to fall under the same role. Yeah. Yeah. Thank you. Next question. OCD patient will have compensatory cure. Patient complain of OCD, bleeding per rectum with prolapse rectum third degree. See, OCD, I will not say. See, you have to understand psychiatric diseases with a very different perspective. When you talk about mind of cell, it doesn't mean all the disorders which are related to the mind. See, in psychiatry, there is a difference between a psychotic disorders and different where the diseases, there are diseases where the insight of the patient is being lost. They are called as the psychotic disorders. So in these cases where the insight is lost, they are labeled as the seventh layer disorders. All mental diseases or all diseases which are coming in the mental phase are not labeled as seventh layer diseases. Yes, schizophrenia. I will say schizophrenia is a disease where the insight of the patient is being lost. So they will come very higher up, definitely. And OCD also, they become very rigid. So psychiatric disorders, I'm still working upon it according to the layers, but still I will say ki simple diseases like a person going into mania and insanity, yes, that is completely a person with depersonalization. OCD is very different. But the patients who are with psychotic diseases where the insight is being lost, see, in psychiatry we divide, the insight is intact, the insight is lost. In OCD patient, the insight is still present, so they are not to the seventh layer diseases. In mind cases, yes, schizophrenia, insanity, mania, cyclothymia, major depressive disorders where the life, the insight and the desire for the life is also lost, the suicidal thoughts, they will go higher up. Dr. Sejal, are you clear? But if you're treating a case with OCD and bleeding per rectum, one more thing I will tell you. When you are talking about OCD, you are talking about mental diseases. OCD is somewhere, if you're very clear with the concept of one-sided diseases guided by Hahnemann sir. So these mental diseases go to the level of one-sided diseases. These one-sided diseases when it is mind and body combination. See, here you are telling me is OCD is combined with body. So anyways, mind will be important than the body. Are you clear? If you, I'll take one-sided diseases. You will understand. This is a very beautiful example. Please remind me over there. You will understand when you're treating these one-sided diseases. In aphorism of one-sided diseases, Hahnemann sir has clearly mentioned this. How we treat one-sided diseases and what are the drawbacks of one-sided diseases, why they become very difficult to cure, and compensatory cure is there in one-sided diseases. Dr. Sejal, are you there? Other doctors, are you clear with the concept what I'm talking about? One-sided diseases when mind and body both are affected. Mind is alternating with the body. If you, I had a case where one disease would go and the second would come up. One disease will go, second will come up. So they become alternating diseases and they are very difficult to cure. But when you talk about mind and body, so a mania patient, which is very difficult to handle, but if a mania patient lands up with a case of diabetes or with hypertension, still better, because mania is something very syphilitic, high grade, into the layers, whereas diabetes is still in the body. Fine. Dr. Sejal Mehta, I think she's not there right now. Then okay, Dr. Sejal, you got clear. You have to read one-sided diseases wala aphorism. You will get the doubts more clearer, and I will definitely explain it when we talk about compensatory cure in future. In left-handed patient having complete on left side, and then while selecting remedy, which side should be considered? We have already taken with this query. What is the hearing law follow in IDDM cases is compensatory cure? Yes, IDDM cases, I think insulin dependent diabetes is not psychotic diabetes, it is sorosyphilitic diabetes, because if it is psychosyphilitic in case of like a type 2 diabetic patient landing up into type 1 diabetes, type 1 diabetes, if it is early age diabetes or diabetes in early childhood, I think it is purely sorosyphilitic. There is no psychosis into it, and therefore, in insulin dependent diabetes, it is going to be a compensatory cure because it is syphilitic and destructive part. Any other questions? Dr. Niharika, are you clear? Any other doubts? Meeta. Thank you. Any other queries? I think the lecture was very informative and taking you to the roots. Those people who had doubt ki why we need to understand embryology. So already I have been taking embryology. I can take another lecture where we can describe all how tissues and organs develop. But that is going to be very methodical. You can go through them in the YouTube lectures also, sessions also, because you can see how the tissues and organs develop. But here my point was to connect the mathematical part and the anatomy part and the physiology part, embryology, the mathematical aspect of homeopathy to the practical aspect of homeopathy. And I think this was my effort, and it has reached to you. And how we understand embryology with the perspective of theory of suppression, the perspective of Herring's law, from where Herring's law have come up, evolution of Herring's law, the evolutionary embryology, how we connected to the cure process, that also we have taken in cases of incurable diseases. So this was somewhere embryology with Herring's law. If you want, we can go ahead, or we can start with something fresh. Please put up your suggestions, what you want ahead, because it will be a new series to be started. We have already ended up with Herring's law ka part. Uh, So thank you. Thanks for your patient listening. Even on your day of holiday you have there. I just want that you all come up with that dedication, devotion, and determination which is required to become a true healer and a true physician. And if you want to gain height and success, what Sir has gained, so he has worked days and nights together tirelessly, and it was very difficult to stop us stalwarts. Then only it is possible to create something magical, to give miraculous results, just leaning upon your couch and relaxing without taking hard efforts will never pay you off. So friends, please come up with your hard work and keep growing and keep going ahead. Thank you. Happy Republic Day once again. Enjoy your day. Thank you. Let's meet up next month. I would request you all to forward the Google Forms to your friends, to your colleagues, so that they can also get the benefit from us and they can join us. Thank you.